Doctor, I often hear about diabetic neuropathy, but what exactly is it?
Diabetic neuropathy occurs when prolonged diabetes leads to nerve damage throughout the body. It often starts with mild tingling or sensory abnormalities, but if left untreated, it can develop into more serious problems.
More serious problems? What kind of things can happen?
For instance, you might lose the ability to feel pain or heat, fail to notice when your blood sugar drops too low, or even experience a sudden heart attack.
That sounds terrifying. What if something like that happens to me?
I understand your concern. The key is addressing it early. In its initial stages, diabetic neuropathy can be managed and its progression slowed with proper care. Let me explain the effects of diabetic neuropathy by breaking it down into 6 key points.
Please, doctor.
The first is nerve paralysis and gangrene. Nerve paralysis means that nerves can no longer function normally. If the nerves responsible for pain or heat detection are damaged, you might not notice injuries or burns.
That can happen without me even realizing?
Yes, and if unnoticed injuries worsen, they can lead to ulcers or, in severe cases, gangrene, where tissues die due to lack of blood flow. Gangrene often affects the feet because they're prone to poor circulation. Treating gangrene can be very difficult and may require amputation.
That's horrifying. I wouldn't even notice if it started happening.
That's why foot care is crucial. Check your feet daily for injuries or burns, and address any issues immediately.
I'll start doing that. What's the second point?
The second is unawareness of hypoglycemia. Normally, when blood sugar drops, your body warns you with symptoms like sweating, trembling, or a racing heartbeat. But with advanced neuropathy, you may not feel these warning signs.
You mean I could have low blood sugar without realizing it?
Exactly. This is called unawareness of hypoglycemia. Without the usual early symptoms, your blood sugar could drop dangerously low, causing sudden loss of consciousness.
That's so dangerous. How can I prevent it?
Regularly monitor your blood sugar levels, especially after meals or before exercise. This helps catch potential issues before they escalate.
Monitoring it all the time sounds tough.
It might seem challenging, but it's essential to prevent serious complications. Making it a habit will significantly reduce your risks.
I see. What's the third point?
The third is fluctuations between low and high blood sugar. This happens when the autonomic nerves regulating digestion are affected, leading to irregular digestion and mismatches in insulin timing.
That sounds complicated to manage.
It can be, but adjusting your diet and insulin dosage, along with regular monitoring, can help stabilize these fluctuations.
Monitoring blood sugar is important for this too. What's the fourth point?
The fourth is silent myocardial ischemia, where the heart muscle doesn't get enough oxygen due to restricted blood flow. Normally, this would cause severe chest pain, but with nerve damage, you may not feel any pain, allowing the condition to progress unnoticed.
That's terrifying. How can I address this?
Regular health checkups and heart screenings are crucial. If you notice fatigue, breathlessness, or other unusual symptoms, consult your doctor immediately.
What's the fifth point?
The fifth is sudden death, which can result from unawareness of hypoglycemia, silent myocardial ischemia, or irregular heart rhythms.
That's the scariest one yet.
It's rare but serious. The best prevention is consistent blood sugar management and regular health checkups to catch potential problems early.
I understand. It's unsettling, but I want to take control of what I can. What's the final point?
The sixth is depression. Neuropathy-related pain, stress, and long-term disease management can take a toll on mental health, leading to depression.
I didn't realize there was a connection between diabetes and depression.
Chronic illness and persistent symptoms can be mentally exhausting. It's essential to care for both your body and mind. Seek support from family, friends, or professionals when needed.
What should I do if I'm diagnosed with neuropathy?
Focus on controlling your blood sugar, check your feet daily, and avoid smoking. If you experience dizziness, rise slowly from sitting or lying positions to prevent falls.
There's a lot to keep track of, but I'll do my best.
That's the right mindset. Small, consistent efforts make a big difference. If you have concerns, don't hesitate to reach out.
Thank you, doctor. I feel more prepared to manage this now.
You're very welcome. Stay proactive, and remember, we're here to support you every step of the way. If you found this information helpful, don't forget to like and subscribe for more health tips. See you next time.